This program is about care of the diabetic patient. After completing this lesson, you will be able to define a food exchange, explain 3 important points about an exercise program for the diabetic patient, describe a routine for daily foot care, and explain the purpose of ketone testing.
We have all heard about diabetes. It seems just about everybody knows someone who has had it. Diabetes is a chronic disease, which means there is no cure. It requires lifelong attention, treatment, and changes in lifestyles. Most importantly, diabetes requires a careful and delicate balance between diet, exercise, and medication. It may seem overwhelming, but it's important for the person with diabetes to stay healthy and prevent complications. In this program, we'll focus on some of the special care concerns of the diabetic patient and look at specific procedures in step-by-step detail. We'll also give you an opportunity to stop the tape for discussion and practice. Circle of control.
Diabetes is a disease related to food and energy. Insulin is a hormone produced by the pancreas, which enables the body to use sugar. Nutrients in food, broken down in the simple sugar called glucose, supply the body's fuel. When we eat, glucose is absorbed and builds up in our blood. In response, insulin floods into the bloodstream. Like doormen, insulin opens cell doors to let glucose in to be used for energy or changed to fat for storage. In diabetes, the doorman is missing or the door does not open properly. This is because the body can't produce enough insulin, or the insulin it produces doesn't do its job. Cells have no fuel to function. While locked out, glucose rises in the bloodstream. There are 2 types of diabetes. About 10% of diabetics have type 1 like Kelly. This is called insulin-dependent diabetes or IDDM. They produce little or no insulin. The cause is unknown. It may be that the cells which produce insulin are destroyed by a virus or are attacked by the body's immune system. Stress may be a factor. Type 1 diabetes usually occurs in young people and often runs in families. Symptoms usually appear quickly. They include increased hunger, increased thirst, increased urination, sudden weight loss, and fatigue. Type 1 diabetics must take insulin injections. 90% of diabetics are type 2. This is called non-insulin dependent diabetes or NIDDM. These diabetics don't produce enough insulin or their bodies can't use it properly. Type 2 diabetes is most likely to occur in people over 40 years of age who have a family history of diabetes, had diabetes during pregnancy, have poor eating habits, or are seriously overweight. Symptoms usually develop over a long period of time. They range greatly and may even be absent altogether. Symptoms include increased hunger, thirst, and urination, blurred vision, fatigue, numbness or tingling in hands or feet, frequent infections, slow healing cuts or sores, and impotence. This type of diabetes is treated with oral medication and/or diet and exercise. The diabetic must maintain a delicate and careful balance between diet, exercise, and medication. Each serves a special purpose. Picture diabetic management as a circle, with each area of diet, medication, and exercise of equal importance. Even a slight change in one area will upset the others. For example, exercising more than usual burns extra calories and will cause a drop in blood glucose. If the diabetic does not return to a circle of control, there can be problems. A treatment plan only works when each area is carefully balanced with the others and monitored by the physician.
The goal of care for the diabetic patient is to keep blood glucose levels as steady and as close to normal as possible. In other words, to maintain good diabetic control. To do this, the person with diabetes will require intensive education and reinforcement in order to learn to eat properly, take the proper insulin or oral medications, and exercise adequately. These are the 3 important areas in the circle of control. Besides understanding the circle of control, a diabetic patient must also learn about self-monitoring and other measures to maintain optimal health. Before discussing important concerns of care, let's check your knowledge. What is the goal of care for the diabetic patient? What are the three areas in the circle of control? What are two symptoms of type 1 diabetes? Meal planning. Diet is one important area in the circle of control. Good meal planning enables the type 1 diabetic patient to better control the amount of glucose in the blood and to improve the body's ability to use insulin. The most important nutrition principle for the insulin-dependent diabetic is consistency. Eat the same amounts and types of food at the same time every day. Meal planning helps the food and insulin to work together to prevent wide swings in the blood glucose levels. Most people with type 2 diabetes are overweight, so meal planning is just as important. Good meal planning enables the non-insulin dependent diabetic to control weight by including the proper number of calories eaten each day and to improve health through nutritious meals and better eating habits. The physician, dietitian, or nurse prescribes the diet and meal plan, taking into account the person's activities, medication schedule, calorie and health needs, and lifestyle. The meal plan is a guide that defines the food choices and the amount, also called exchanges, that the patient can eat for meals and snacks. The food exchange list makes the meal plan work. Each food on an exchange list has about the same number of carbohydrates, proteins, fats, and calories. In the amounts listed, all of the choices in a list are equal and can be exchanged or traded for any other food in that list. Looking at the fruit list, 1 apple is 1 fruit exchange, and it can be exchanged for 1/2 banana, 12 cherries, or 1 1/4 cups watermelon. There are 6 exchange lists: starches and breads, meats and meat substitutes, vegetables, fruits, milk and milk products, and fats. There is a 7th group in the exchange list called free foods. This group includes foods that are 20 calories or less and can be eaten in any desired quantity at any meal, except when a specified amount is noted. Using the exchange list and following the meal plan provides a greater variety of food choices and controls the distribution of calories, carbohydrates, fats, and proteins to help the patient maintain good blood glucose control. Meal planning ensures that the patient eats the right amount of food at the right time. Meal planning may seem a bit confusing, but once you become familiar with the foods and the amounts, it will become easier. Let's try planning a sample menu using a 1,500 calorie meal plan. The meal plan states that for breakfast, the patient can have 1 exchange from the fruit list, 2 exchanges from the starch bread list, 1 exchange from the milk list, and 1 exchange from the fat list. Looking at the fruit exchange list, we can select any one of these foods in the amount listed to include in our plan. How about orange juice, a good source of vitamin C and potassium? 1 exchange would be 1/2 cup. For breakfast, the starch bread list offers cereals, pancakes, and breads. Let's give the patient 1/2 cup shredded wheat, low in sodium and a good source of fiber for 1 exchange, and 1 slice of toasted white bread for the other. The fat exchange list includes both saturated and unsaturated fats. Let's stick to the healthier side and select 1 teaspoon of margarine for the toast. What's left? 1 milk exchange. The milk exchange list is divided into 3 parts based on the amount of fat and calories. But in the amounts listed, each food counts as 1 exchange. We'll add 1 cup of 2% milk to the meal plan. And we can add a cup of black coffee because it's a free food. It wasn't too difficult to plan breakfast for our patient. And by studying the exchange list, you can see that the patient could easily add variety without changing the structure of the meal. For example, we could have substituted 1 whole bagel for the cereal and toast and 1 tablespoon cream cheese for the margarine. Just to be sure that you have the knack, let's do lunch. The meal plan calls for 1 meat exchange, 2 starch bread, 1 vegetable, 1 fruit, and 1 fat. This is our first look at the meat list. Like the milk exchange list, the meat list is divided into 3 parts based on the amount of fat and calories. How about a 1-ounce broiled hamburger patty? The 2 bread exchanges add up to 1 hamburger bun, since 1/2 a bun is 1 exchange. Foods on the vegetable list provide minerals and vitamins. Let's use the 1 exchange for a sliced tomato. Put a couple slices on the hamburger and the rest on the side. For a truly gourmet burger, add 2 teaspoons salad dressing, which is 1 fat exchange, and some green onions and lettuce, both from the free foods list. For a beverage, give the patient a glass of iced tea from this list. Looking at the meal plan, we see that there is 1 fruit exchange left. 1 cup of fresh raspberries would be good for dessert. These 2 meal plans should give you a good idea of how the food exchange list and meal planning work. We've filled in the afternoon snack and evening meal, focusing on variety and good nutrition. But we didn't do the evening snack. According to the plan, the patient can have 1 starch bread, 1 milk, and 1 fruit exchange. Using the exchange list, take a minute to test your skills and plan the evening snack. As you practice with the list, you'll be able to try more combinations and even work in some favorite foods. And just because these diets follow a plan does not mean they have to be tasteless or unappetizing. Use fresh-dried herbs or spices as seasoning or bouillon to cook the vegetables. And there are also brand sweeteners and substitutes which can be used. Check with the dietitian or nurse first. It's important for your patient to follow the meal plan carefully, to eat meals and snacks at regular times, and don't skip eating. The meal plan can be adjusted to meet changes in school, vacation, work, or travel schedules, or when the patient's activity, weight, or eating patterns change. And to maintain good health, remember some other important points.
Read food labels carefully when shopping. Avoid foods with corn sweeteners, syrup, honey, fructose or dextrose high on the ingredient list. They are all forms of sugar. Sugar-laden foods include baked desserts, ice cream, jelly, and sweetened cereals. Saturated fats may lead to heart disease and high blood pressure. Substitute liquid unsaturated fats. Foods with high saturated fats include meat and dairy products, lard, butter, solid shortenings, salad dressings, coconut and palm oils, and chocolate. Sodium and salt causes the body to retain water and can lead to high blood pressure. Use less salt in cooking. Encourage your patients to add less salt at the table. High fiber foods help lower blood sugar. They include whole grain breads and cereals, dried beans and peas, fruit and vegetables.
Time for some more questions. What is a food exchange list? Can you name 3 of the exchange lists? What are 2 important points about diabetes and meal planning to remember? Exercise. Exercise is the second important area of the diabetic circle of control. Exercise and physical activity is good for everyone, but it's especially important for people with diabetes. For the insulin-dependent diabetic patient, exercise improves the fitness of the heart, lungs, and muscles. Stabilizes the blood glucose levels because exercise helps the body burn up glucose faster. Reduces the risk for complications and helps the patient maintain a healthy and active lifestyle. For the patient with type 2 diabetes, exercise improves the body's ability to use insulin and helps control the weight by burning off calories. The exercise program should be an aerobic activity to improve the fitness of the heart, lungs, and circulation, and involve the large muscles to strengthen them. There are 3 good types of aerobic exercise: swimming, biking, and walking. Walking is an activity just about everyone can do. It doesn't require any special skill or expense. Regular exercise, the same amount and type every day, is important. Before starting an exercise program, a diabetic patient should get approval from the physician. The doctor and patient will decide the type and amount of exercise. The program will take into account how many calories the body will burn for each minute of exercise. This chart gives you an idea. Walking burns 4 to 5 calories per minute. If the patient walks for 30 minutes, that would be 120 to 150 calories burned. Here are some other important points for the diabetic patient to remember when exercising. Start slowly. A moderate exercise program done every day for 20 minutes is fine. There should be a warm-up period of at least 5 minutes and a cool-down period of 5 to 10 minutes. Monitor blood sugar levels before and after exercise. Learn how to handle low blood sugar reactions. This can be a common concern because exercise can burn up glucose in the body. The physician may instruct the person to carry some quick source of glucose while exercising, such as a candy bar or glucose tablets. Follow the physician's instructions for any adjustments in food or medication. Drink plenty of water on exercise days, especially on hot and humid days. Exercise not only burns calories, but it also increases sweat production and body heat. Some diabetic patients may experience an increase in blood sugar after exercising. However, the patient should contact the doctor or nurse for a large increase or a moderate increase which lasts for several hours. If the diabetic patient experiences above normal sugar and a positive urine ketone test, that indicates control problems, and exercise should be put on hold until the patient shows better control. For some patients, an exercise program is not practical because of physical limitations. These patients may benefit from a home exercise program. Once the program is established, encourage the patient to perform the exercises every day. Let's review some important points about exercise. Can you name one type of aerobic exercise which is beneficial for the diabetic patient? What are 2 important points for the diabetic to remember when starting an exercise program? Foot care. Good foot care is essential to maintain optimal health and prevent complications. Serious foot problems are most likely to occur in diabetics over the age of 40 who have had diabetes for more than 10 years. But foot care is essential for the diabetic person of any age. The risk of infection due to injuries is increased because diabetes can cause thickening of the walls of the blood vessels, decreasing the blood supply to lower legs and feet. Diabetes can also cause damage to the nerves of the legs and feet, which is called neuropathy. Neuropathy causes symptoms of pain, numbness, burning, or tingling in the legs and feet. The patient is unable to feel cuts, burns, bruises, ulcers, sprains, or symptoms of infection or other conditions that would normally produce pain. Some people have both nerve damage and poor circulation. These 2 combined can cause serious problems if the patient doesn't practice good foot care. A blister or sore could go undetected, resulting in an infection or gangrene, a serious infection which threatens blood supply. If not treated, gangrene can lead to the amputation of the infected area in order to save the rest of the leg or foot. Experts agree that 50 to 70% of foot amputations among people with diabetes can be eliminated by prevention, early recognition, and proper treatment of foot problems. Prevention begins with a daily routine of good foot care and exercise and measures to protect the feet. It is also important to know about the signs, symptoms, and problems to report to the doctor. No matter how young or old the diabetic patient is, good foot care is essential. The diabetic must keep the feet clean and dry. We'll observe Catherine as she performs and teaches daily foot care to a newly diagnosed diabetic. Here's the procedure. Use a basin of water for foot care. Test the water temperature with your wrist before putting both feet in. Wash the feet with mild or superfatted soap. Avoid vigorous rubbing. Dry the feet thoroughly but gently with a soft towel, taking special care to dry between the toes. Inspect the feet for cuts, dry skin, cracks, blisters, and any changes in skin color or temperature or any signs of infection. Use a hand mirror to check the soles of the feet or get assistance from another person. Apply mild cream or lanolin to the feet if skin is dry. Do not use alcohol preparations or apply creams or lotions between toes or to open cuts. If the feet perspire heavily, use a light coating of mild foot powder, non-perfumed powder, talcum powder, or cornstarch. Sprinkle it lightly between the toes and on the socks and shoes. Don't let powder cake between toes. Use a small piece of plain gauze, cotton, or lamb's wool between toes which overlap. Trimming toenails requires caution to prevent cuts or ingrown nails. This may be a task which is best handled by a nurse or podiatrist, particularly if nails are thickened, tough, brittle, or difficult to file. Follow these steps. Trim nails after a bath or foot soak. The nails will be softer, easier to trim. Use a professional nail clipper. Cut nails straight across and not too short. Be careful not to cut the skin. Use an emery board to remove sharp edges. Instead of trimming, you can also file toenails to the desired length. Avoid cornering nails, and don't dig under the toenails or around cuticles. Be sure to contact a doctor or podiatrist for any problems. Regular, daily passive or active exercise is essential to maintain circulation. Here's a good exercise to try. While sitting, point the toes upward, then downward. Repeat this simple exercise 10 times. Then make a circle with each foot 10 times. The diabetic patient must also pay attention to shoes and socks. Wear clean, dry socks. Socks or nylons should be even and smooth. Socks that are mended or lumpy can put extra pressure on feet. Avoid tight socks, stockings, or garters with elastic tops. Shake out shoes to remove any small objects before putting them on. Wear shoes that are wide and long enough to allow toes to wiggle without pressure. Shoes should be comfortable, fit well, have good support, and provide protection. Check worn shoes for rough spots in the lining. Avoid shoes with rough seams that rub on the feet. Break in new shoes by increasing the wearing time by half an hour each day. And it is essential to guard against any injuries. Don't go barefoot, even in the bedroom. Don't wear tight-fitting garments or sit with knees crossed. Never cut corns or calluses or pick at rough spots on the feet. Seek professional attention. Avoid putting hot water bottles, heating pads, or electric blankets on feet. Burns may occur easily, particularly if there is a decreased sensitivity. For cold feet, wear socks or use an extra blanket at the foot of the bed. After exercising, inspect both feet for blisters, cuts, or any signs of redness. For minor cuts or scratches, wash the area with warm water and mild soap. Dry well. Cover the area with a dry, sterile bandage, using paper tape instead of adhesive tape. Monitor healing closely and report any problems to the physician. While inspecting the teenager's feet, Catherine notices a bruise. The patient reports this happened during a basketball game. It does not cause pain and is decreasing in size. She'll watch it closely until it heals. To maintain good nutrition and a healthy blood supply, eat a balanced diet, limiting the amount of cholesterol, saturated fat, and caffeine. And stop smoking. You must also know about these signs and symptoms to report to the physician. Signs of infection: redness, swelling, pain, drainage, skin which is warm to the touch, or fever. Numbness, tingling, burning, or other signs of decreased sensitivity. Change in skin color or temperature. Blisters, abrasions, cuts, or lacerations which are not healing or show signs of complications. Puncture wounds. Plantar warts. Remember, early detection and treatment can prevent major foot problems. Time to check your knowledge. Why is foot care so important for the diabetic patient? Can you describe the steps in daily foot care? What are 3 measures to prevent injury? Stop the tape now to review the procedure for foot care. Complications.
You should note 3 serious conditions that occur when the daily routine is unbalanced and control unravels. Hypoglycemia, or low blood sugar, is sometimes called an insulin reaction. It results when blood glucose falls below 70 milligrams per deciliter. It happens suddenly, in minutes, or a few hours.
Hypoglycemia results when there is an imbalance in the circle of control. In the area of diet, the diabetic did not eat enough food, ate the wrong foods, or missed a meal or snack. This results in less than normal glucose in the body. In the area of exercise, the diabetic had more physical activity than usual, such as a longer exercise period, resulting in extra glucose being burned. And in the area of medication, the diabetic mistakenly took too much insulin.
Your patients may experience lightheadedness, hunger, a fast pulse, shakiness, nervousness, pale skin, or numbness and tingling of the mouth. They may have nausea or a headache, be cold and sweaty, confused or moody, or have trouble walking or seeing clearly. If possible, they should test their blood glucose. If treated immediately, hypoglycemia is easy to correct. A diabetic who has one or more of these symptoms should eat or drink something sugary to raise their blood glucose back up to where it belongs. Even if they can't test their blood glucose, it's better to have it a little high than let it get too low. Give fast-acting sugar, such as 4 ounces of regular soft drink or fruit juice, or 2 teaspoons honey or syrup. Most patients have concentrated glucose tablets or gel prescribed. Gel is squeezed into the patient's mouth just inside the cheek. Know where it is kept. If you are permitted to administer gel, your nursing instructor will show you how.
Understanding the causes and treatment of hypoglycemia are important, but it is absolutely essential to recognize the symptoms so immediate treatment can be implemented. Because hypoglycemia can happen so suddenly, it's important to know what to do. If treated immediately, it's easy to correct. Stop the tape now to discuss the symptoms and treatment of hypoglycemia. The second serious condition is hyperglycemia. Hyperglycemia, or high blood sugar, results when blood glucose levels climb to 240 milligrams per deciliter or above. This usually happens slowly and is not an emergency. But if blood glucose stays too high over a period of time, it may cause very serious eye, heart, and kidney problems. Like low blood sugar, hyperglycemia results from an imbalance in the circle of control. A diabetic person ate the wrong food or too many calories and fat, did not exercise regularly, or forgot to take insulin or oral medication. Other factors like infection, illness or injury, an operation, and emotional stress can also affect the blood sugar. Hyperglycemia results in these symptoms: increased thirst, increased urination, drowsiness, irritability, blurred vision, frequent infections, and slow healing of cuts or sores. To treat hyperglycemia, the patient must return to a balance between diet, medication, and exercise. The physician or nurse will help the patient accomplish this. Because hyperglycemia happens slowly, these measures can help the diabetic patient prevent it. Follow the prescribed meal, medication, and activity plan properly. Test blood glucose regularly. Look for a pattern of high blood glucose levels and call the doctor if the levels do not come down. Follow a sick day plan. The sick day plan will probably include these instructions. Take the usual dose of insulin. Drink plenty of liquids. Regularly test blood glucose and urine ketones. Adjust the diet and medications only with directions from the physician. Call the doctor immediately for any unusual symptoms. And the diabetic must treat illness seriously and call the doctor or nurse when there's an infection or illness lasting more than 24 hours. The last serious condition is ketoacidosis.
Ketoacidosis is dangerously high blood glucose, an emergency that usually requires hospitalization. It can happen very quickly, especially to people with type 1 diabetes who have colds, flu, infections, or other illnesses that unbalance their daily routine. Ketoacidosis occurs when there is not enough insulin to move glucose into cells. Fat is broken down for energy, forming poisonous ketones. Ketones build up in the bloodstream and spill over into the urine. High ketone levels cause ketoacidosis. Symptoms of ketoacidosis include extreme thirst, frequent urination, stomach pains, nausea or vomiting, and fruity smelling breath. If the blood glucose is above 240 milligrams per deciliter and there are ketones in the urine, the patient needs emergency help. Unless the condition is treated fast, the patient becomes gravely ill and may even die. Take a minute now to discuss the emergency plan for the patient with ketoacidosis.
Let's review some important concepts about complications of diabetes. What are two symptoms of hypoglycemia? What is the treatment for hypoglycemia? What is hyperglycemia? What is ketoacidosis? What is treatment for ketoacidosis? Ketone testing. Testing the urine for ketones will help the diabetic detect the early stages of ketoacidosis. It is essential to test the urine during an illness or when blood glucose rises above 240. There are several commercial products for ketone testing, but the dip and read reagent strips are the easiest to use. It features a color scale to measure the quantity of ketones in the urine. Here are the steps in this simple but important procedure. Gather the supplies. You will need a clear container for the urine, reagent strips, and a watch or clock with a second hand. Put the supplies on an appropriate cloth or paper barrier. Reagent strips come in a bottle or a box. When using a bottle, replace the cap tightly. Strips in a box are individually wrapped in foil. It's important to have adequate lighting so you can accurately match the strip with the appropriate color on the color chart. Use gloves as dictated by your agency policy. Observe good hand washing practices. The diabetic patient does not need to wear gloves for self-testing. Collect a urine specimen in the container. A fresh, second voided urine specimen will give the most reliable results. For a second voided specimen, instruct the patient to urinate. 30 minutes later, have the patient urinate again, saving this specimen to test. This test can also be performed during urination. Hold the strip so the test block faces up, but don't touch the block. Dip the end of the strip with the test block into the urine for about 2 seconds. Then remove the strip and gently shake off the excess urine. Hold the strip horizontally and immediately begin timing, following the manufacturer's instructions. After waiting the recommended time, compare the ketone test block with the color chart to determine whether ketones are present. Clean up and dispose of used supplies following agency procedure. Remember to practice good hand washing. Keep a record of the test results with other important information, recording the date, time, and results. Stop the tape now for a discussion and demonstration of ketone testing. Be sure to focus on agency procedures. Diabetes might not be your patient's primary problem, but whatever illness or condition, diabetes will affect their treatment. Your patient's care plan will provide information and direction for all care. Remember the circle of control and the importance of maintaining a balance in all areas. Be alert for complications. Know the warning symptoms and emergency actions to take. It is often the scrupulous care and vigilant action of alert and informed caregivers like you who have made it possible for diabetic patients everywhere to overcome distressing complications of their disease and look forward to full and happy lives.